All right. Good evening, everyone. I'd like to call the meeting to order. Town of Fairfield Department of Health, Board of Health meeting at 7:32 on September 13th. Hopefully everyone got a copy of the minutes from the last meeting, had a chance to take a look at them. Does anyone have any comments, questions, edits, corrections? Seeing none, can I get a motion to approve the minutes as submitted? Thank you, Dr. Hotchkiss. A second. Thank you. All those in favor?
Aye.
Opposed? Abstentions? Great. Motion carries.
Okay.
Fantastic.
We should, for the record, we should do a roll call of recent attendance.
Oh, fantastic. Maybe if we could just go around the table, that might be. I'll start. Henry Yoon.
Sance Cleary, Director of Health.
Christine Vitale.
Carolyn Durkee.
Mary Frances DiSteno.
Jill Mitchell, Nursing Supervisor.
Mark Hotchkiss.
And
Sally Connolly.
Excellent timing.
all right.
All right, fantastic. So the next agenda item is Director of Health report.
Okay, so I'll share about some notable meetings and events that have happened since our last meeting 2 months ago. While we continue with our regular weekly CDC calls and our weekly State Department of Education, Department of Public Health joint call, and our weekly DPH meetings that we have in terms of just them providing information to us, updates, being able to ask questions. Some of the other events that myself and or Jill have participated in on August 3rd, we did with the Board of Education, with the parents really, it was a question and answer session where parents submitted a little over, I think it got up to 300 and some odd questions, and so we worked to break them down into categories, and we had myself, Jill, and Dr. McDonald were on, and Superintendent Cummings, and in the time that we had, provided the best responses we could to the sort of categories of questions they fell within. We couldn't possibly address all those questions in the time, but we did have that meeting on the 16th of August. I did participate in the Board of Selectmen meeting and provided a COVID update and a Q&A session with the selectmen and selectwoman. On the 19th, I did have a meeting with the Fairfield Community Emergency Response Team, provided them a COVID update in terms of what are the likely. It's a volunteer group of emergency response volunteers, and so met with them in terms of the volunteer expectations going through the fall in terms of what we think we might need, and just having them understand that we'll likely call on them for some of the different issues that will probably come up. On the 21st and 22nd of August, the health department responded to Tropical Storm Henri. Both Jill and myself and a few of our school nurses, we participated in EOC meetings both Saturday and Sunday. Sunday, we set up a shelter over at Fairfield Ward High School, and the CERT team operated that shelter. We provided 3 nurses.
Two.
2? Okay. 2.
Kara and myself.
Kara and yourself? Okay. So the shelter was staffed and had nurses there ready to go. Obviously, the storm didn't materialize in terms of what was expected, but we were ready to go. We could have housed hundreds of people. We did have 2 people show up that had been involved in the Rooster River flooding a few storms ago, and just felt like they didn't want to be in their house while that was happening. And so by about 12 at the EOC, we were confident that nothing was really going to materialize, and we had the shelter closed down. So that went well. It's good exercise to try it with that. It's the first time we set up at Ward. So it was a good exercise, and we had great collaboration with the school staff that was there. It was really
They were great.
Yep. And then on the 24th of August, Jill and myself participated in another Board of Ed meeting where we essentially responded to questions from the board members during the meeting. The 31st of August, the Health Department hosted the International Overdose Awareness Vigil at the Sherman Green, which was a very powerful event, and it was fairly well attended. But it was a great event, and we're happy to do that another year. On the 9th of September, I was asked to speak at the Fairfield Beach Residents Association's annual meeting. Did that last week in terms of talking about mostly about housing issues, and they face a lot of different issues in residing with the students down that area. So a lot of different presenters, police, the first select woman, myself, but provided just sort of some general concept of how we do enforcement there to prevent overcrowding or limit, to enforce overcrowding, and then also just responded to general questions about a variety of topics. So in terms of what's going on in town, at our last meeting on the 12th of September in Connecticut, overall there were 35 hospitalizations in Fairfield County. There were 11 hospitalizations. As of today, Connecticut, there's 327 hospitalizations and 83 hospitalizations in Fairfield County. So, almost a little under nine times increase in hospitalizations, 7 times increase in Fairfield County. The week that included the 12th in July, 2 months ago, 7/12 to 7/18, Fairfield had 9 cases. As of today, we have so far up till the yesterday, we have 76 cases this week, and that what happens, that's just as of today. We'll still see for the next few days reports come in, so we expect that number to probably go up by at least 20 more. So we're seeing, a really good increase. We think will be, 80 between 90 and 100, so like a 10 times increase in cases from the last time we met. So in general, things have been, as of late, the cases were trending slowly upward, but not at a significant rate this week. We may see a little difference in that. The hospitalizations seem to see, the Connecticut, the peak was about the 24th of August, with Fairfield County peaking about a week later, 31st of August. And then we started to see a decline, but as of late, last few days, last week or so, we've started to see more of a leveling, such that from a trend perspective, we're still seeing sort of level cases both at the state and at the county level. So we'll continue to watch that. We watch other countries like Great Britain and Israel and see what they're experiencing that are a few weeks ahead of us in terms of their experience with the Delta variant. And Great Britain, continues to see increases. If they saw a large increase around the time of the international soccer tournament that they hosted, but if you look at the line outside of that tournament, it's relatively been going up. We saw a big peak, then it came down, but then it started continuing to go back up again, and it's continued to go up for a number of weeks. That peak ended, their highest peak was like July 19th, dropped down for a couple weeks, and then it's just been continuing to rise back up again. Israel seeing the same kind of thing, continued increases. Last week or so, they saw a small decline, but then the last couple days, that started to go back up again. So we look at that, and I bring that up just to say, as other people have said, and the state epidemiologist and former FDA Commissioner Scott Gottlieb has said, we're not sure how this is going to go, and the potential is that we could see some downtrends, but then things can continue to go up. We're not sure. Things are, at least in terms of hospitalizations, are holding somewhat level right now. But no one has a crystal ball in terms of exactly how this will go. What we're seeing today, a little bit change in the demographic. We did see an increase in university-related cases, evenly split amongst both universities. That will, that will be a concern. That I've already communicated with the university, show them what we're seeing in terms of data, and to make them aware of that. And they're aware of the cases, but just to make them aware of that. But in general, we're not seeing clear downward trends as of yet. I mean, it's some things are leveling, some things are increasing. In terms of the week over week cases is a good way to look at it, and that's seeing a steady increase week over week in terms of what we can expect. The hospitalizations and deaths will be delayed after that, and so if the cases still go up, it's likely that the hospitalizations will eventually follow. There's been some recent studies put out about the Delta variant causing twice as many hospitalizations, not some more severe illness, but more hospitalizations. And so, we'll keep an eye on that. That might be what's, sort of driving things. And so that's, to keep it brief, that's sort of a general COVID update. Our contact tracing efforts, because of the increase in cases, has been quite demanding. And I'll let Jill talk about the schools later, but in terms of the number of cases, every one of those new cases that we get, requires a call, requires their contacts to be identified, requires those contacts to be called and reach out to, and lots of discussions. And when it's school related, it adds some additional challenges. So in terms of booster shots, so that's what is the next thing on the horizon for the health department in terms of demands on our time, and those demands, as was providing vaccinations that we did for 6 months straight, that was a significant demand on the health department. It was I don't want to say all we did, but it was that, and contact tracing was about all we did, and evenings, weekends, and a long time. And so while we don't expect the booster demand to be quite as significant as that was, it has the potential for us. There are more providers available than when we started back in December of last year, so that should help with demands upon us. So we've already scheduled some. We had a whole series of them scheduled, but because of delays with both FDA and ACIP are FDA is not meeting till Friday to look at that, and then ACIP had a meeting, I think it was yesterday, and then they're having another one end of September. And so ACIP is usually one who provides the final okay to issue them. At this point, it looks like it's just Pfizer initially, and then sometime later Moderna, and then sometime later there'll be a J&J, potentially J&J booster recommendation. But we'll wait and see. There's not uniform agreement with the members of the ACIP on this, and so we'll see how that moves forward. But in the meantime, we've had to sort of cancel some of the dates that we thought we would start with those clinics, and so we'll keep you updated on that. And then in terms of vaccination rates, what we're seeing right now in Fairfield as of the last data, they post data usually late Thursday or Friday morning for the entirety of Fairfield. at least one dose is 70.62%, and for fully vaccinated is 66.38%. Of note, the 12 to 17-year-old group, first dose is at 72.9, and for fully vaccinated, they're almost identical to the town at 66.64. So they've really caught up. We still see the 18 to 24 is a little behind with the between first and fully is 62.84 and 54.99. So they're a little behind, and that's, as I think I said before, it's a lot of the college students that are counted in our population are vaccinated in their home states, and so those things aren't included in the CT-Wiz registry, that how the DPH tracks that, and so that's there's actually asterisks on the state language to say, college towns, you'll see a dip in this age range. At last I looked, which was about a month ago, the town where UConn is, the township, I think Mansfield, was like 25% vaccinated. It's like it's not actually what's happening. It's just a fact that the population, because the census includes students in the estimates, and those estimates, those students are vaccinated elsewhere, the numbers are just so low. But for the rest of the group, we're, for 25 to 44, we're at 82 and 76, 45 to 64, we're at 90.3 and 86.9 for fully vaccinated, and then the 65-year-olds are doing great with 97.7 for one dose and 93.48. And so we're seeing a good gap in between those numbers, which we like to see, is that meaning that there's lots of people in the pipeline, so we should hit those higher numbers eventually. Back a month and a half ago, 2 months ago, the gap was like 1 percentage point, 2 percentage points between first dose and second dose, so there really wasn't that much demand going on. So we're glad to see that increase happening, and but we continue to push vaccination. So in terms of that, we are setting up additional clinics in more convenient locations. So we have 2 scheduled at the fire stations, Reef Road Fire Station and Jennings Road Fire Station. That'll happen this weekend, and we'll be pushing information on that out in terms of getting people there. And then both high schools will actually be hosting high school-based clinics at the end of this month, and the high schoolers and the middle schoolers will be able to participate in those. And that'll be first and second dose, so they'll each hold 2 clinics, so we'll have 4 additional clinics to sort of just continue our efforts to kind of push those numbers and make it more convenient for people to get vaccinated.
Parents have to come with them, though, in those, or like?
So anybody above 15, like 16, 17, 18, 17-year-olds would be able to have just a signed one from their parents.
Oh, okay.
The 15 and unders, from what I've been told, so it will need a parent. 12 to 15-year-olds will need a parent with them. So we're working with the schools and DPH to arrange this, and DPH has these mobile vans that show up and run the whole thing.
Oh, so crowd control, that's what I was trying to, okay.
Yeah, so they'll come and run the whole thing. The schools just have to sort of coordinate the facility and tables and chairs if they need them and things like that. And so it makes it easy on us, so we can focus on contact tracing and planning for booster clinics, and so, but with that said, that is my report.
Great. Thank you, Sans. Does anyone have any questions for Sans? Yes.
I have a question. Okay, so you mentioned you said right now 76 cases so far in Fairfield. I think that's what you had said. So how many of those Fairfielders needed to be hospitalized? Do you know the numbers for that?
No, we don't have local hospitalization data. That's not provided to the towns. So it's only based on county levels.
Right. So my concern is kind of we're back in, an entire year later of just really the emphasis being on cases, and, instead of what are the implications of those cases, right? I mean, we can talk about cases, that's important, obviously, but what's actually happening with those people if, 99 point something % are ending up like we all know, all 4 of my kids had COVID. They all recovered fine. I have many people that I know who recovered or were sick, but they didn't end up needing hospitalization or dying, right? I'm just being very straightforward with it. And so, I mean, my question is like, and even in home health care, when I've discussed it with our Norwalk office, our nurse supervisor there, and all the patients that we're seeing, and I sent this to you in an email, I get a fax of every single patient that's referred to us. And I'll tell you that the patients that are being referred to us are all of the substance abuse, alcoholism, the mental health piece. I mean, COVID is like on the bottom of the list of what's being treated. So again, like I know I've brought this up at other times in other meetings, and I so appreciate that, the overdose the overdose awareness vigil that occurred. I couldn't go to that, but I did go to SHU Community Theater for the movie, which, by the way, my family and one other person were the only people who attended that entire movie out of the entire town of Fairfield. So I just think we need to be, this is a board of health, right? And so in the board of health, there's more going on in health than just COVID. And like we continue to kind of be discussing, and I get that that's like, those are the numbers that you're getting fed primarily, but I still have this major concern that we are just not looking at the big picture of everything, and certainly I've seen how it's affected. I brought it up at other meetings, obviously the mental health piece, I'm not going to rehash that. I had a good friend who had to pull her daughter from school because of everything going on and how the schools were treating kids and, the ramifications of it. So it's just like, I think my question for you really is like, what is the plan? So that's one question. I mean, like, what is the end game beyond the wait and see? Because that's what we've been discussing for so long. The second thing that you didn't mention was actually anything about the in-town mask mandate. I've been going to variety of events around Connecticut and in Fairfield County, and that's definitely not an across-the-board mandate. And so from what I have heard is like you were a primary force, pushing for that. And I just, I do have an issue with mandates, with just like across-the-board mandates, and people were told, okay, if you get vaccinated, and honestly, like to me, I think it's actually kind of making a mockery. I can't tell you how many restaurants and stores I've gone in where nobody's wearing masks, like the employees, and because they're choosing, this is my business, this is my establishment, these are the people, we work together, and, we're comfortable making this health choice for ourselves, right? In the same way, like I said, when I look at home health care and look at all the reasons why people go into the hospital, it's because they chose to, and of course it's a disease as well, but to be using substances, using alcohol, obesity, diabetes, we can go on and on and on with all those health choices that, and we're focusing on just the COVID piece. And, I'm kind of want to ask, at what point is there that freedom for a business and an individual to make that choice and decide what is that risk-benefit analysis? We know now that vaccinated individuals have a very low risk in the hospitalization and death category right now. Correct? I mean, the majority of people who are getting sick and dying are unvaccinated. And again, it sounds callous. Some people will yell at me for that, I'm sure, or send me a nasty gram. But they're making that choice. I mean, just like somebody can choose to ride their bike or motorcycle without a helmet, and we're treating them in the hospitals for a traumatic brain injury, the list kind of goes on and on. I can see people are uncomfortable with this conversation, but I just think it's something that we kind of need to discuss that's not being discussed. And I mean, it's a voice of, I'm here on the board as a voice not just for me, but to represent who I believe are my constituents, and it's definitely resonating, not with everybody. People have different opinions on this, very much so. But when you see that people in our town, businesses, workers, are, blatantly choosing, that's not what they want to do because it's not their prerogative, we're in America, like, that's their free will, whether we like it or not. I mean, so I know it's a bit of a soliloquy, but I kind of would like your opinion on the case versus the hospitalizations piece, because we keep talking about cases. I mean, if we did it for other viruses, we'd be here all day,
Yep. So, how can I say this succinctly, is that, in public health in general, we work at preventing diseases and the spread of diseases. That's what we do. And the diseases that the population at greatest risk right now is those who are unvaccinated. And the largest group in that is children in schools are unvaccinated. So they are at greatest risk for getting COVID right now. And that's what we're seeing in the numbers, the unvaccinated. That's why I wasn't ignoring you. I was looking up stuff. 70% of the people who are new cases right now are unvaccinated or not fully vaccinated.
Okay, but there's still the distinction between
yes,
the
cases
under 12.
And hospitalizations. Yes.
What is the distinction between the under 12, which is in a completely different population breakdown? Like, I would like to see those numbers between the under 12 population who cannot because it's not available and approved,
yeah.
Which, by the way, let's all remind ourselves that in the UK, in Europe, they actually do not recommend vaccination for that population at all, except for those who are in a higher risk category on that age. I think that's something we do kind of need to, this is not like, I think something we need to acknowledge that, like, very smart individuals and health professionals just over the sea have made a different choice, over the ocean than we have. But again, I'm going to go back to the point that if the 12 and overs are choosing not to get vaccinated, that can irritate people, it can make us upset, but the bottom line is that that's their free will and their healthcare choice to make that choice, right? And therefore, to put these controls and parameters on an entire town, on the individuals who are, the one example that, again, I know I bring up the social media, but I think that's important for people to know what happens, is what's been happening is post after post after post. I went into this place and these people weren't wearing a mask, and oh my gosh, who do we report this to? Who should we say it to? And again, is that what we want? Those 5 individuals in that business have the free will to say, I'm working. I seriously doubt that every single person in this room, when they're with 4 or 5 of their closest friends, that they're all 100% masked all the time. I don't believe it. I just don't believe it, And I think that we're, trying to put, whenever you put mandates on people, it's that kind of, the psychology piece kicks in, right? The more you push, the more there is that, people need to have their self-revelations, whether we like it or not. You can recommend things, but I think, again, mandates, in my opinion, I'll go on the record of saying that, are just not the way to go when it comes to personal health. So I just want that to be, like, very clearly on the record, because I feel very strongly about that.
Okay.
Well, I've written a number of emails and haven't gotten any responses from you, so now that I'm across the table, eye to eye, I'm making it very clear.
Yeah. No, I get that, and we've gotten emails from yourself and others who agree with your opinion, as we've gotten emails from others that are asking us for a different take, that want us to do even more.
Make those choices for themselves and
yep. And so
the public sector.
Yep, but as you know, we are trying to, limit the spread of a disease in our community that has the potential to impact people. That is currently causing people to be hospitalized, that is currently causing...
Which we don't even know the number, because we know that there's 76 cases, but we don't know how many of those Fairfielders are hospitalized, so we actually don't know the direct implications then on our actual population. So therefore, we're making these decisions based on like the wait and see principle or on more of a fear principle, in my opinion.
It's, public health is about population-based health. So we're looking at trying to reduce the impact on the population in general, and by limiting the number of cases, which the goal of mask use is to try and limit the number of cases and the transmission. We're trying to do a number of things. Limit the cases, so we limit the hospitalization, so we limit the deaths.
Okay, but
and then in the schools, we're trying to preserve time in class. That's the goal of this year, is to get as many, and Christine can correct me, keep as many kids in school all day, as many days as possible. We're implementing all sorts of...
Okay.
All
right
sorts
now,
of,
I'm actually not, I did not...
Excuse me, I'm just going to ask you to let Sainz finish his comments.
Yeah.
If you'd like to make a comment afterwards, that's great, but what and I appreciate the dialogue, because I think it's really important, and at the end, I probably would like to make a comment or two in regards to
well, I do want
to add,
that
but if we can just
I did send a
understand.
number of emails and got no response prior, which you guys have asked me to do, and you can look...
No, I understand, which is why, so if we can just let Sainz finish.
Yep. Yeah, so I mean, I think we've been clear, we've tried to be clear on our goal, is to limit the spread of disease in our community. And by doing that, we limit other variables that happen. And by some of those actions that we're taking regarding the schools, which is, not a local decision, it's a governor's mandate at this time, that, that is designed to do what everybody was striving for, is as much time in the schools, in classes, learning as possible. And so we're masks is one of those tools, but we've also worked with allowances at limiting quarantine in terms of shortening the time to the 7-day with the test after 5 days. The distance has been reduced, so the change in the quarantine allowance reduced the distance to, if you're greater than 3 feet, then you don't have to quarantine. If you're vaccinated, you don't have to quarantine. And so we're applying all those things to shorten the impact of COVID on the community to help the students stay in class, and we're trying to do a number of measures to address reducing the impact of a disease. Now, yes, not everybody ends up in the hospital, but people do end up in the hospital. The numbers show people ending up in the hospital, and people are, thankfully, not a lot of people, but, the last person who passed in Fairfield was, someone who was a parent, and again, I can't really say much detail on that, but, the disease is having an impact on our community, and, we try to put in place reasonable practices. What the state has done is remove all or most of the other restrictions, in terms of gathering sizes and all sorts of restrictions that have been lifted, and we're down to, in schools, the few mitigation strategies that we have are masks and distance, and some of the other ones that were, in terms of the cleaning protocols and ventilation and all that. And then in the community, the only one we're asking is that, when people go indoors, to put on their masks. So that, as the first selectman said, that'll be a temporary measure until we see some sustained improvement going on. But anyway, that's,
I'd like to make a comment too. Just as a nurse practitioner who's admitted a lot of people for COVID over this time, I think and you could add your opinions too, but our first instinct last time, or the first time COVID came around, like in the springtime, that was the first thing sent to the hospital. Now we have realized that's not our knee-jerk reaction anymore. We're trying to keep them at home. So hospitalizations, maybe that's why they're not focusing them as much, because we're trying to keep them home as much as possible, because we're not throwing them on the vents. We can't use the nebulizers. that kind of stuff in the hospitals, well, I don't know about the hospitals, but the nursing homes, like, we can't. So, for example, my daughter's friend's father, who's immunocompromised, is positive. So I told the family, look, if you need me over there, I have my similar thing, I will go and help, but our goal is now to keep them out of the house. We're not doing that knee-jerk reaction, so that's part of it. The other comment you had made, too, about the health department and, focusing on other things, just know that I am part of Fairfield Cares now. They asked me to join, so they haven't met through the summer. Mm-hmm. So that's why, you had that event recently, but they haven't met over the summer, so that's probably why that part has not, the mental health part, too, which is, I think, part of them, and the overdose has not been as much as the forefront just because they took the summer off. They're reconvening, I forgot the date, sometime in September on a Wednesday or something, a Wednesday morning, so they'll be starting up again, so that could be part of it, too.
Yeah,
I think the focus is...
No, and I appreciate that. The only reason I was interjecting with Sandra is because I was not in that particular questioning asking about the schools. So you were discussing a lot about the schools. My one major question had to do with the masking in the community, the town mandate versus the schools.
It's hard because the governor's telling us to, until he comes out again at the end of the month or something. I think he's
not necessarily.
We have to follow
not necessarily for the towns, though.
Yeah.
I was talking about the towns. The towns is not a mandate by the governor. There are many surrounding towns that do not have the mandate at all. So that is a Fairfield specific.
Who are the
Stanford does as well. I could
There's
name
lots of
a
towns that don't.
Yeah, I don't think Darien does, I don't think...
It's not a
Greenwich
mandate.
does.
Canaan,
the school's mask is a mandate from the state.
Shelton, I could go on and on and on. So that's what I was referring to. I just want to clarify that because I don't want to come off like I'm being uneducated and not knowing the parameters of the governor mandate. So I'm specifically asking because that's something that we are going kind of above and beyond. And again, just wanting to reiterate, like you said, with the CARES, that is an organization. I've gone to many of their events over the years and got a liaison for Tomlinson PTA, which I'm involved in, through Rainey, who's, been at Ward and been very involved in that. So I think, again, there's just like that concern that Director of Health, the health department, right? The primary goal is not just infectious disease, right? That's what it has become, but I think there needs to be that point of stepping back, and certainly Christine knows that, it's not even all been published yet, but there have been major declines in academic performance throughout the pandemic. There have been a lot of issues because of, I say as a speech pathologist, of the social, emotional piece of being able to have the readiness of reading, of language development. So it's so nuanced, and I think that I just want to remind you and everybody that there is a bigger picture. We are perseverating on this, and there has been reason to. Don't get me wrong, it's been an important issue, but at what point do we say there are other important aspects of like the holistic person as a child and as an adult that are so important to their being and living life. So that I'll just finish on that. I appreciate you listening to me. I'm trying to do it without being overly emotional.
I understand what you're saying, Sally. I think that there's a large proportion of our residents under the age of 12 who we're trying to protect. Mm-hmm. And when we say if everybody agrees in the school that it makes sense for the children to wear masks, they're used to it now. I think that the academic performance will probably get better. They're there at school. I think a lot of that was when they were home. So it's a lot different. But it remains to be seen, and that I'm not sure. But I think that when we talk about here in the community and businesses and towns, here in the local towns down on the Post Road and on Black Rock Turnpike, when people walk into a store, that translates. Those people are going home to their children, and if they're all walking around without masks, is the risk of our children getting infected higher? It has to be. It's a certainty in infectious disease and epidemiology that there will be more cases if everybody just said just throw away the masks and get rid of them. So it's really just a matter of really thinking through what is the best way that we can without businesses are open. It was so different when this first started. Hair cutting places were closed, restaurants. Now everything's open. So I think that those restrictions appropriately are now, life is not back to normal, not completely. But I think I keep thinking back to there's so much we still don't know about this virus. And there's no reason to panic, and I'm not saying that it's going to explode and all our children are going to get horribly sick, but a certain portion will, and we know that for sure. And I think if there are things that we can do, and again, every town is different. People make different decisions. I don't think it's so burdensome to ask somebody if they're going into a supermarket, wear the mask. We're gathering together. People are breathing on each other up and down the aisles. A lot of people have children at home. It's an easy way to help protect the children that we all want. We all want them to stay healthy. And we don't know. Nobody can tell us for sure what the long-term effects are. Just like, I know there are other viruses around and a million things. Influenza is, but this is it's all so new for us. I know it's been 2 years. That's pretty new in the world of infectious disease. That's quite new, right? So those are the things from a medical standpoint. I'm not a pediatrician. I take care of totally the opposite. I take care of patients who are chronically ill and the most vulnerable. And from that standpoint, it's making sure they all get vaccinated. But the children, it's not. We don't know that it's safe. We hope that it will be, and I think that it will be, but we don't have enough information. So I'm certainly not recommending that a 9-year-old go against any recommendation to get. They shouldn't get vaccinated now. So if they can't, then it's up to us to protect them. And also when you said about the 12 to 18, sometimes they may be old enough to make decisions for themselves, but they're still following the advice of their parents. I think. I can't imagine that a 12-year-old is going to do something on their own.
There is that, but I will say that, because of how healthcare has now, let me just paraphrase, let me start again. Because, 14 and over now have their own choice, right, in their decision making. It just really depends on the kid, and you can't force that either. I'll tell you that my other kids who can be are vaccinated, but one of my kids doesn't want to be, and I can't force that on him. So what are we going to do about that? What do you want me to do about that?
No, but I think that
that's his choice.
When you're talking about that's true. But when you're talking about children in that age group, there are some 16-year-olds who are very mature and will make decisions for themselves. But I'm sure I would have to talk to the child psychologist. But my take on that would be that there's a huge influence on what the parents' opinion is about all this. So if both parents are, for whatever reason, against getting vaccinated, it's probably unlikely that the kids are going to think a lot differently. And they have other influences. I understand they have friends, they have other teachers and other people who they listen to. But I think that we still, as adults and as people here who are making decisions responsible for public health, I think we're under the obligation to protect those who, especially children under 18.
So if I could just add to that and sort of round out this conversation, because I really do appreciate the conversation, I was just going to add, many of you have brought up the points that I was going to mention. I personally try to walk that fine line between the role on this board as focusing, as Sally has pointed out, and actually all of you have pointed out, this idea of public well-being and health, right? We're a board of health. And so not to necessarily pass the buck on the other leaders in our town, I think they're the ones who set a lot of these mandates and whether they infringe or don't infringe on people's rights, I think our responsibility is primarily to give them what we feel as though is sound evidence towards their decision making. It's just like the Board of Ed. I go to the Board of Ed that I work with all the time and I say, here's my opinion, here's what I think. From a clinical medical standpoint, it's pretty much a no-brainer. Doesn't mean the decision when it comes to the school is necessarily a no-brainer, but from the clinical aspect. So when I hear about folks, and I'm just sort of throwing this out as a not to contradict anything that's been said here, but just to help clarify the rationale. In my mind, one of the reasons why we don't want other people getting sick, in addition to we don't want people sick ending up at the hospitals and that sort of stuff, is we don't want them getting other people sick, right? So every person who gets sick is another person who risks spreading it, whether they know it or they don't. Every person who gets sick is another opportunity for the virus to mutate. And that we really can't. So, look, in my younger days, I used to wear a motorcycle. My wife hates it. I used to never wear a helmet because it wasn't required. It's my right. I can do it. This is what I want to do. And if I take a header, then...
I can tell you a story about
But my point is, if I don't wear a mask and I affect other people, there is that potential. And so I just want to, again, just share that perspective. I will finish my commentary by saying I very much appreciate this dialogue. What I love about this dialogue is it is not tit for tat contradicting, right? This is not a, masks work, masks don't work. The question is, how do we use them? Where do we use them? Under what circumstances? So I do appreciate that, Sally. I appreciate the fact that you, again, introduce or reintroduce the idea of the mental health and other aspects that are clearly is just as important now as it was pre-COVID. But I think that's very helpful. And so I really appreciate everyone's participation in a collaborative and a constructive dialogue. So thank you for that. But Jill's giving me that. I want to give my report on it. So if there aren't any, yes, please.
Just, Sam, some questions just about the universities. Are they both requiring their students to be vaccinated?
Sacred Heart has a vaccination requirement. Fairfield U does not, but Fairfield U is at 91% vaccinated. So which is higher than
students and teachers, out of curiosity?
Students and staff.
Okay.
Yeah, which people were from the initial estimates of how many people would claim medical exemptions to vaccination. The various entities were saying probably about 15% would claim that. So they're above that, but and they're higher at 91%. They're higher than what we're seeing in the town in general.
Just flashbacks to last fall, and just knowing that we had a lot of
it's concerning.
Cases that drove our numbers.
It's concerning anytime you see a spike or increase in any particular group. Yes, I had the same thoughts of that's what we saw first last fall, and so we're in a different situation right now. We went into school with a much higher rate of much higher level of viral activity in the community, and we're bringing back in, we have some protections as well. We have vaccinations, so there's all these variables going on of a higher rate of infection in the community, a good rate of vaccination in the community, coupled with a variant that's more than double the infectivity. So versus the heritage strain, which infected 2 to 3 people, the current estimates are COVID Delta infects 6 to 7 people. So it's that, and coupled with that with the recent MMWR that showed that it's around twice as many hospitalizations for the Delta variant. Those are all things that raise concerns to a lot of people, and then it's I'm parroting what the state epidemiologist has said in some of the weekly SDE meetings of the things that they're concerned about is as we go into this school year, this large movement of people from all over the country coming here to Connecticut and to the colleges, and all the kids that we had a relatively, restriction-free summer, and coming back into schools with that higher viral activity in the community, it just raises some concerns on some of the folks at the state, and hence led to the governor sort of changing some of his executive orders to allow towns to adopt stricter standards if they chose to.
Sorry to ask another question,
Can I just follow up?
Oh, yeah.
For hospitalizations, and I don't know this, emergency room visits, does that count as being admitted or not? Are those numbers, so people, because I've known people that have had COVID,
Yeah.
they've had breathing issues, and they've gone to the emergency room, they've been in the emergency room for almost 2 days, gotten their breathing under control, and then sent home.
Yeah.
If it's 2 days, it would be
Well, I mean,
admitted,
but never,
if it's
but
observation,
still, or it
like
was
24 hours.
Yeah, but they don't always get the bed.
They don't get the bed, so
They
they
stay
stay.
The documentation is that they're still,
Insurance, you have a
they're still
problem.
ER, so that doesn't count as
It
hospitalization.
doesn't count, so there might be cases that
Right.
go to the ER,
Yeah.
and then
Right.
just my own,
There's a
curiosity
different,
on that.
emergency rooms and Durovic surveillance data set that's out there. That I may have it in the update here, but there's different set data sets, but I think they separate out hospital admissions.
So one thing I don't think you mentioned, and then I know Joe wants to talk, but about the breakthrough cases, because I did read a recent article. I was thinking you must be happy we had predominantly Moderna, because it looked like the resistance to Delta, what I read anyway, was 95% Moderna, 80% Pfizer, and 60% Johnson & Johnson. I don't know if anybody else saw that, but that was like a recent article that there was just the most effective ended up being the Moderna. But anyway, I'm just kind of curious if there was any other info on the breakthrough rate that we're seeing, because that obviously has been a bit of a game changer.
Yeah, in terms of a rate of breakthroughs, I think we're at about, right now, I think it's 80-20, 20%.
Cases.
Out of 100 cases,
20.
I think Tina said 77%.
Yeah.
For break,
We're,
23.
unvaccinated, I'm sorry, yeah.
Well, in terms of cases, we're, it's in that ballpark of, basically 80-20. What I was looking for here is, just some of the stats that came out in terms of the number, like we've had about, 10,000, 9875 of breakthrough cases in fully vaccinated people and 70 deaths in fully vaccinated people. But the rate, of being infected with COVID is still 5 times higher for those unvaccinated. The risk of being hospitalized is 5 times higher for those unvaccinated, and the risk of dying is 10 times higher for those unvaccinated. It's something the state put out in their report last week.
Just one number that I have, we have had 195 breakthroughs since April, 159 of those since August 1st.
Is that Fairfield specific?
That's Fairfield
Okay.
specific.
Is that the 77 number that you said?
Yeah.
Sorry, you said
Okay,
195 since April, and the second stat was
159 since August 1st.
additionally, or
No,
the
100,
majority
Of
of
the
them were
195.
post-August.
of the 195,
Got it.
159 has happened since August 1st.
Got it, so
so you
only
changed it to the
36
Delta.
between April and
So they're
August.
saying it's 100% Delta.
100% Delta, that's what I remember, because we didn't really have it
Huh.
in Delta last April, May, June.
Yeah, you also have to keep in mind there's a phenomenon that I'm sure we can all appreciate that, so if you look at absolute numbers, those numbers are going to be higher in towns or states or counties that have a higher vaccination rate, right? Because your denominator is bigger, so you've got more people.
Right.
Yeah.
So I think it's the rate, and that's a number that they're having a hard time sort of calculating. But just something to keep in mind, because we ran into this in Stanford all the time. But we look at the number of breakthrough cases, like, oh my goodness, look at that compared to all. But when you look at the absolute number,
Well, I was thinking that as well with pediatric, because it was like, so, even though there is, and there might be a slight increase, it's, if you look at the absolute number versus the fact that, okay, most of those are unvaccinated, so
Right.
it's just the denominator. So obviously media reports things,
right.
but it's
No, you're right. If you look at the
But-
rate in terms of the number of pediatric cases that are going up, it's doubling, tripling, quadrupling.
Right.
The absolute number is still relatively low.
Right. Okay.
Great.
Actually,
Okay.
it's fewer than 10 breakthrough cases in under 18
Mhm.
since April.
Okay, very minimal, okay.
Would you like to segue into your report? Or was that it?
I'll talk about school reopening, okay? Are we done? Is that okay?
Yeah. One-
So far.
Okay. Very, very busy. Actually, our daily health room visits have already climbed up to pre-pandemic levels. The nurses are certainly working quite a bit. Our sub-staff is not as robust as I would like it to be. They need a lot of, sorry?
In terms of numbers, you mean?
In terms of how many sub-nurses, well, we have quite a few, but not very many of them are willing to work in the schools. I have a roster of 15 nurses and only a handful.
Oh, like per diem?
That's right, yeah. So I'm recruiting. We've hired 4 nurses in the past couple of weeks. We're almost fully staffed at each of the schools. We've had to use the staff from my office to go out and cover the schools, so it's really been a stretch. Let me see. Since I can't say quite the beginning of the school year, but we started tracking the positive cases in the children just prior to a few days prior to the start of school, because it would impact, quarantines and who's going to be in and who isn't going to be in. We've had 38 positive cases so far. 30 of those are students. 8 of them are staff. And very small numbers have not been vaccinated in the school setting. But a couple of them were breakthroughs. 98 individuals in quarantine. But as you all know, the quarantine rules are really very, very different this year. And even with all those students in there, even with reducing to 3 feet, I think masks, I guess it's really not something I should say, but I think that masks as our primary mitigation effort, in the lower grades at least, has been very effective. We have not had any definitive in-school transmission. And I have to tell you, I was holding my breath this weekend because there were quite a few cases at the end of last week, and it would have shown up, and it didn't. We still have cases that, the social cases, kids having sleepovers, things like that are happening. We had a couple of cases in the sports teams. I don't really want to say which ones, but the kids were vaccinated. We didn't have to quarantine anybody. They were playing on Friday night, I think.
Yep.
And, I'm really happy about that. I'm really happy that using these, getting vaccinated, we're really approaching a level of normalcy that we haven't seen in a very, very long time. I hope it continues. I don't know, because the Delta variant is extremely transmissible, and I'm concerned about that. But that's where we stand now. I will say, we're in the 3-foot rule in the classroom, which is great. The kids are close together. They're doing group work. That's something of a distance, but they're able to do it. And we haven't had any issues in terms of in-school transmission, and I think it's a real positive. And, the other thing is the test out, the 7-day test out quarantine. We used to do 10 days. We still offer that to everybody, the typical 10-day quarantine. But you can test out on day 5, 6, or 7 after your exposure. And I think, let me see, I did have that. Of the 98 individuals in quarantine, 36 people have used that. Students, not staff. I don't have any staff who used it, but students.
Sorry.
I don't think they need it. I don't think they need it.
They're like, a few extra days.
I can't say that, Sally. I really can't. But parents are really happy to get that, I can test on this date, great, I'm gonna go do it and get my child in a few days earlier.
Yeah.
And I tell you, if it falls on a weekend or whatever, it makes a real difference in their lives, it really does. So, I can't say I'm like super happy with it because I'm not. I wish it was all over, as I'm sure all of us are. But I think that we're taking some really important steps in keeping them as safe as we possibly can right now.
What about flu clinics?
We have 900 doses sitting in our refrigerator right now.
We have
So
dates
that we
set.
do other things. We really do other things.
Yeah,
with
'cause
COVID.
last year there really wasn't a flu season with all of us wearing masks, but I'm just...
We still vaccinated.
Still vaccinated a lot of
Yeah.
people,
Not again.
Oh, yeah.
100 people last year. And then we have flu vaccination clinics on the books. In terms of tentatively, we would kind of wait till we have all of our doses on hand before we announce those dates.
Yeah.
But yep, we'll be doing it again this year, and it may be a
Joint.
COVID and flu clinic. So it'll be that'll be a
No,
challenge.
really, it's true. They want us to do it.
Yeah.
It's
a nightmare.
Technical challenge with the VAM system and having to do a VAM system and a paper-based system at the same clinic, and having to have people doing just flu and others, and the ratio of how many vaccinators doing what, and all those kinds of things. So it presents challenges.
Are you finished?
Sorry?
I'm sorry, are you finished with I was gonna open
Yes,
up for
I am.
questions.
Yes, I am.
Thank you. Yes, so.
Surprise, surprise, I have a question. So one was quarantine, I'm a little surprised, I think that's great, first of all. Positive is that I think those are all like great steps. Obviously, if somebody had to quarantine last year, my kids, then I think that's awesome, the testing out, and that there's that progress. I am surprised that there is as much quarantining that needs to happen, as much quarantining as there is, given the fact that now it's like the 3 feet and not the 6 feet. Is that mainly like the bus, or is it because of their social outside settings where they saw people? I'm just curious, where that's happening.
It's very, very few in the classroom. I'm saying less than a half a dozen kids, I think, are quarantining when it comes classroom exposure.
So it's
but
more
you have
like,
lunch, and you have bus, and you have the social aspect.
Okay.
But, actually, Sally, with 30 students.
Like 3 per person.
Yeah.
Well, from that, yeah.
That was a lot.
Yeah,
a lot
much
more
better
last year. A lot more.
No, I was just kind of curious about that. So that's the first question. And then I'm going to push this again, of course, is that...
Music?
Okay. Because I'm telling you right now, again, I'm going to just put it out there. Let's just remember that we have contact sports happening, inside, outside, all of these things have been happening. And my kids, it's literally going to make me cry, basically, couldn't sing. You know what I mean? It's been so restrictive for the musicians.
Mm-hmm.
And again, I'll tie that back into, this is my plea as someone who is, a performer, right? I mean, and I'm going to make it analogous that an athlete, right, what do? They compete, right? They compete with spectators, and for a while they had to deal with nobody watching. That was kind of a bummer. You don't have people cheering. Well, then it transitioned to, we do have people cheering. We do have the dancers or some semblance of cheerleading, people there for us, right, like to support us. That's part of the interactive experience that athletes have, right? So same for a musician, what happened all last year, and again, people were trying to do their best, but to be practicing, to be rehearsing in these isolated settings, right? I think about my 5th grader who started saxophone last year and doing virtual lessons, and it taking closer towards near the end of the year to actually get together. A lot of people quit, and this is my plea again for our Fairfield Public Schools, and I know Christine had kids very much involved in music. And just imagine if your daughter wasn't able to be the lead in musicals, The thing is that this is what defined those children, right? In the same way as somebody who is like the head of a sports team, or like that's what they're great at. And you can be great in academia, like in kind of more of a quiet space, right? But for performance, it has to be done kind of out loud. It has to be done with other people. And my understanding is that, there is guidance, like that the same guidance that the health department went by and Board of Ed went by to create some of the initial restrictions the State Department, I should say, my bad, that we went, let me switch around. We followed those, parameters and the guidance from the state, which came from a parent music organization. Well, some of those were already changed, and I know I sent this in an email, but from the 6x6 to the 3x3, right? And musically, you just need that to interact, to hear each other, right? To communicate. That still has a box of some sort of, you still have some distance, but we have to figure that out because these kids are losing that ability to perform, right? To perform with an audience, and I think that from us and from you, Sands, and Jill, and whoever else it is, pushing for that and advocating for that.
Sally, please know.
Yeah.
I contact the state every week specifically about the music instruction and the restrictions on the distance there.
Right.
They have not responded. I am waiting desperately for Addendum 7 to come out again. They have not changed it since last March. Do not think that we are unresponsive to your, demands and all that. I agree with you. I think they need to push it forward.
Well, I think also, again, just to be devil's advocate, though, is that you made a choice as a town right now to do a town mandate for a mask mandate. That is not what the governor said. So we are not always acting in tandem with the governor and the state guidance. And I think at some point, again, stepping back and looking at the big picture of we can have, or you can have, or however to say it, some autonomy in that department, because, and again, I'll do the public school versus the public sector, to have my son's band performed at Sacred Heart University Community Theater Saturday night with Jose Feliciano and a variety of other musicians, and they could do that. And there's a way to allow those things to happen. Sure, they checked vaccination cards. They checked whether somebody had a negative PCR test within 72 hours prior. There was masking, except if you were eating in a restaurant. So there are some mitigating factors. And again, let's look at the Bridgeport Amphitheater, which I've seen many of our public officials attending as well, and Fairfield residents. So these are things that are happening. To my knowledge, I'm not hearing about some crazy influx from one particular event, because oftentimes they have a mitigating factor. And at what point can we push more to allow that for our teachers? Those music teachers are really suffering right now. They are suffering because they have a passion, they have a vision of what they are, that's their life's work, and they can't do it. Take that for anything that any of you do, and if you can't do what you feel like you were born to do, right? So anyway, just looking at how that affects the kid. This isn't just about COVID, this is also about hey, parents are fine with, I'm fine with my son performing in this venue or this venue. Those parents are making decisions too with their kids about whether or not they want to be involved. And so you talked about, as a parent, and keeping your kids safe. There are many people who make the choice, myself included, that this is more important than some potential underlying risk of COVID or something else, And that's
I agree with what you're saying. I don't mean to cut you off, but I agree with what you're saying. My son performed yesterday in School Rock. He's a performer too, and they're able to do it at FGC. But to Jill's point of view, we need the guidance too to say, what can we do to our schools? I pay for an outside thing because he's a drummer, so he doesn't have one drum, so he could do the whole set. So I pay extra for that, and yes, he was able to perform. Everybody wore their masks.
I have friends in that too, so yeah.
But it's different in the schools. We have to get some guidance from, what we do, because God forbid there is a big influx. I mean, parents would be on you, they'd be on everybody, if there was something that happened.
But have we done I don't think every single iota of every decision that was made through Board of Ed or schools was 100% exactly by guidance.
No, but we need some guidance. If they're not answering your emails, then, we have no guidance. So.
I'm trying to think if that's true, Sally. I mean, that any of our decisions were not
I think
made
that they were very
according
much
to guidance?
because of the Department of Health, that we did not make it, I don't think that we,
I suspect that's the case, that if anything, you tend to be able to be more restrictive, but not less.
Yes, that's true.
So, for example, this mask,
Right.
mandate that's been left to individual municipalities is, the governor has said, well, I'll leave it to you guys based on whatever formula you're using. So you can be more restrictive, you just can't be less. So.
But then I think that we could be looking at, certainly, just like in the public sector, where there are all of these rehearsals and events and everything occurring right here in Fairfield. I mean, let's just say even the 12 and over population, that those theoretically are in the exact same boat as the public sector of who potentially had the choice to vaccinate or not. And again, those parents can choose for them, maybe put some little clause in there that says, you will not be penalized if you don't want to participate in this concert or rehearsal or something like that. They're not mandating from that side. There's a choice. Just like you can choose to put your kid in School of Rock. My son does his band. My other son does Jim Royal Drum Studio. They're all having these performance opportunities, and that's because we're paying out of pocket. But how about all the kids who don't have the money to pay out of pocket, who are relying on the public schools? They're becoming disadvantaged because of the restrictions. I mean, I'll get off that soapbox, and I appreciate that you are. I, again, don't want you to think that I don't think, but I think at what point is it like, are we just waiting indefinitely? Like it's my son's senior year. It's not a lot of other kids' senior years. I mean, this isn't just about my kid. This is about the collective group of frustration and the teachers, because I've heard from them too. So, put that on the record as well.
Thank you. Any other questions for Jill? No? All right.
but Jill, thank you. I mean, I went to the Ludlow football game on Friday night, and it was really a lot of fun, and just to see kids outside and sports back, and just together.
Where's the pep band, by the way, Where's the pep band outside at all this?
Well, and Sally, when I was there, that's pretty much what I thought. This is an opportunity where we just need to be creative. We need to be creative in terms of safer ways to let our singers perform. And I give our music teachers a lot of credit in terms of the opportunities they did provide to students. Last year, I know it's not the same as a live performance. I mean, I'm not going to talk about my own personal with my own children and the effect that had on my child that was going to be a musical theater major and no longer is. But, I give our teachers a lot of props. I think about the concert that they did last year. It was virtual, but it also allowed students to perform and share to your point about performing in front of an audience. It wasn't a live audience, but it was accessible to the town. I mean, I think that there's some good things that have come out of it that we can move forward, but I hear you in terms of giving these kids an opportunity to perform in front of a live audience, outside, a larger venue. But I also am concerned about not following the health guidance and possibly putting them in a situation where a concert becomes a spreader event and we need to become more restrictive, potentially.
I would want to see the data from which of all of the concerts that we've had over in the town
I mean,
and all of our venues.
It's hard because you're talking about adults that are vaccinated. Very often people are, to get into a venue, you have to show a vaccination card. At the amphitheater, it's outside. Sometimes performers like Broadway, everybody needs to be vaccinated in order to perform, and you don't have the same ability right now to require every student in the band required to be vaccinated. You know, we assume that they are, but we don't necessarily know for sure.
You could easily do it for the high school level.
And you have to be inclusive. It's a little bit, the rules are a little bit different.
So nobody can do anything.
No, that's not, that's not what I'm saying. I'm just saying that I want you to know that you have been heard, and it's the second week of school.
Not responded to by most people, but okay.
All right, sorry I took over your meeting, Anderson.
No, any other questions, concerns? Okay, great. Let's move on to communication. Sam, do you have any communication?
I have none.
All right. Any old business?
No old business, no.
All right. The next item on the agenda is new business. We do have an item to discuss. I would like to add an additional new business item to discuss communication strategies for the Board of Health. So I would like to make a motion to add an additional item under new business to discuss communication strategies for the Board of Health. Can I get a second, please? Thank you. All those in favor? Okay. Opposed? Abstentions? Great. Thank you. Motion carries. So why don't we start with the first item on the... Yes?
Yep, item A.
Okay.
So this is actually a repeat. We actually approved this a couple years ago, but so the State Department of Public Health is seeking to have greater depth of bench in terms of people able to serve as acting directors of health in the absence of the director of health. When I'm away, sick, things like that. So what I'm seeking, and I did request this to the board a few years back, and it got the approval to have Jill, the nursing supervisor, Rob Guerrera, the environmental health supervisor, and Santina Duranco, Dr. Santina Duranco, our community health coordinator, to be approved as acting director of health. Then a couple things happened, and Phil Pyle and a bunch of other things happened that we never got our act together and submitted the documentation to the state to request this. So it's essentially giving them the authority to serve as acting director of health if I'm out. Right now we have one of our sanitarians, Amy Lahaney, who is qualified to serve in that regard, has been doing it solely when I go on vacation, when I take a few days off, and so I just want to have more depth in that area, and so that I'm asking that our three assistant directors of health have that approval to act as acting director of health when I'm gone.
All right, so can I get a motion to approve the staff members Jill Mitchell, Robert Guerrera, and Santina Duranco to serve as acting directors of health during the absences of the director of health? Second, please. Second. All those in favor? Opposed? Abstentions? Thank you.
Thank you.
Motion carries. The other item that we just added to the agenda is really for discussion. As you know, communication with the public is a big part and responsibility of being on the board, and we want to be as accessible as possible to those who want to reach out with either questions or concerns or comments or opinions. And so there was a recommendation, and this is a practice that's, I believe, done on other boards, where there's a central email address that's really a forwarding mechanism. And so the recommendation is that the Board of Health adopt a generic email, and the Board of Health or whatever. That would allow anyone who would like to send an email to all the Board of Health members, just an easy access. It is not a separate email, but really sort of a distribution a forwarding mechanism to send that out. So that's something that's been requested. I think that's very reasonable. I think what's the ask of the board members is, which email would you like it sent to? Because if you do reply from that email, your email is public. Now, we all have our emails listed on the website as it is, but
no, they're not currently listed on the website.
Oh, so they just find mine? They just, they just find it somewhere?
I think it's just our names.
Yeah, it's just,
Okay.
just your names are listed on,
Yeah.
names and the term.
I don't know if we're Democrat, Republican, or Independent.
I've been blaming Sands for that for years, but I guess they just find it. In any case, so this would be a mechanism so that the public would have the opportunity to do that. So, the discussion part is, to ask all the, Board of Health members if they would think about an email that they would like these forwarded to. That's the first part. Did you want, I was gonna go.
So, yeah, it's essentially, you know, if you don't want to go into the current email that we have, you know, for you, that you received the emails from the Board of Health, that's the only one we have. If you would like it to go to a separate email address, if you could provide that, you know, you can create a Google email for, you know, your name and Board of Health, you know, and just provide that to us, and we'll include that. But just let me know, you know, if you're in the process. You can just email me if you want. If you're planning on doing that, setting up a separate email just for the Board of Health, just let me know, and we won't move forward. But I guess, you know, and then based on that, if you think you're going to do that, then I'll wait until, if I don't get anybody telling me that, then we'll go ahead and assign that. So that will enable people just to email, you know, everybody at once. It'll forward. I'll be copied on it because that preserves an archive of the emails. And then, but if you reply, then they'll have whatever email that is your personal email that you choose.
So we'll all get a copy of anything that goes to that, whatever email we set up.
Gets forwarded to
all of us.
Yep.
Yeah, so there'll be a Fairfield BOH members email,
Right.
and then people click on that, and it pulls up, and whatever they send to that goes to everybody at the same time. And then, you know, we'll have a discussion about, in terms of, you know, the replies to that, you know, and it's as you know, of course, any member is free to reply to any email they want. You know, it's just, you know, if it's asking for we'll have to think about if they're asking for an official position from the Board of Health, that would have to follow a different process.
Right. And actually, that was a great segue. That was the other point I was just going to bring up. You know, this isn't a practice that we've done in the past, so it may be new, because, I know the Board of Ed has a mechanism, but again, others may not be as familiar. So as Sands had pointed out, remember, anytime you would reply from that, your email that you're replying to that become visible to whomever. Should you decide to respond in that manner, then please keep in mind, in order to sort of archive the response in the town's email system, it's important to copy Sands on that email as well. Should you decide that that's what you want to do,
yeah.
Right? It's not a requirement, but that would allow that to sort of be memorialized in the system. Yes, and to be requested. Again, you bring up a good point. You know, Freedom of Information Act, you know, allows anyone in the public to request, you know, this type of information, and so that would be as well. The other part that Sands was mentioning was, being that this is relatively new, we don't have a mechanism. I don't think we've had a need very often to respond with an opinion as a board. And so I think the idea is, again, as Sands has mentioned, if you want to reply individually to whomever responds, that's great. If you want to reply privately and not include Sands, then that doesn't go in the system. Doesn't mean that it won't get screenshotted or forwarded or whatever. It just means that it's not archived within the town system and FOIable. The other part of that is, if anyone wanted to respond all to the group email, that response would go out to all of, again, the Board of Health members as well.
Well, that you should not do, just in terms of FOI, because you have to be sensitive to any discussion in email being a meeting.
Okay, thank
So if
you.
we were all on an email chain and we started having a discussion, that could be considered a meeting.
Right. Okay, well, thank you for pointing that
I was
out.
planning to give you a call to
Yeah.
talk about
Nuances of,
how do you handle this, in terms of, do emails go into the minutes and all that kind of thing?
No,
Yeah.
That would take forever.
no, I
Can you
mean, and,
imagine?
very often, the Board of Ed gets so many emails, and would like to say that it's just impossible to respond to them all. Very often, it's the public is willing to just share their thoughts, but don't necessarily expect a response to every email. It's just an avenue for the public just to share their opinions, not necessarily be guaranteed discourse, I guess, on every item. Just for your time, it might be, we've got 60,000 people, 60,000 people emailed you.
I think they have.
And
Twice.
you're trying to each one.
It feels like.
Well, I just,
Right. So we're not making any decisions at
Yeah.
this point. I think this is really a discussion because it's relatively new. I know it's new to me, so there may be questions as soon as I walk out I have, but it's a practice that I think we're going to be putting into place. I think the homework that we're asking at this point is, what email would you like it sent to?
Yep.
And then we can continue to have a discussion, and if between now and the next meeting, a request is made of the board, then there's mechanisms in place for special meetings, emergency meetings, things like that, if that becomes necessary.
And just while I have you here, does anybody think they'll set up a separate linked email? You will?
Yeah, I think I will.
Okay.
would the emails be flagged, like that they're coming from the board of the BOH email address? Because right now my emails from you goes to my Board of Ed email address. And just getting Board of Health and Board of Ed mixed together just could be
Yeah.
a little bit confusing.
I would have to talk to IT in terms of
Yeah,
how that's set up. I don't know
So
what
I
the
would
flagging
probably set up a
would be.
separate email address.
Yeah.
Okay.
I already have like 5 anyway. So
Yeah.
so this thing's
Oh my
quite bad, and
gosh.
just, I hit all inbox, to go through them all
I
the
think it's a
time,
great idea. I think it's
but,
a
yeah.
good
It's a
idea.
smart idea,
I
because then
think just if people want to, reach out and
Yeah.
share their thoughts and opinions, and it's valuable to us to hear from the public.
Well, people also want to know that, like you said, accessibility, right? Just that people
Also, they're
are
feeling they have a chance to be heard, and
not hiding behind like some curtain, right? And they're there.
So the other thing that we could discuss is while we're going to do that group email, we can list your emails individually in the BOH members section. We can just put them there, and that way people can reach out to you individually if you want that as well. If you have an opposition to that, or if you'd like that, we can do that. Some boards have it, some boards don't. And so.
I don't mind.
Yeah.
I have to have it listed.
Okay. All right. Carolyn, you're okay with that?
I'm fine.
Okay. All right. Well, those of you who are going to do separate emails, then just send me what those new ones are, and I will ask IT the question about being flagged. And once we get all those assembled, then we'll just make it happen.
Right. So just to clarify, and I don't know if since this is in terms of, or if anyone knows, so in terms of an FOI request, so if, for example, I send, that email is sent to my personal email, and there's an FOI request, does that mean I have to go through provide my personal emails, or go through my personal emails to find those that are applicable? Obviously, that doesn't open up all your personal emails to the request, it's just
the applicable ones. Yeah, so by essentially copying me, or maybe copy the health DEPT email, it gets entered into the town system, and so we can, the folks downstairs can do a bunch of different searches and pull up all emails related to this, that, and the other thing, and so that's one way that we can. It's just archived, and we wouldn't have to reach out to you to say, hey, we've had an FOI between about a conversation between, you know, Dr. Hotchkiss and the board, the town would be able to produce it. Right?
Yeah, the town would produce it based on his email that's attached to it if copied.
Yeah.
So we don't have to do the keyword search.
Right. So I just want people to
Yeah.
be aware of that as a consideration, so.
I would probably have the Board of Ed, just for email, ask the school system to set up just like a specialized email address for the Board of Health rep changes. Like, I may not be the rep.
Yeah.
Member, so it's not, just for ease for the website.
Okay.
All right. Great. Well, if no one else has any additional questions or concerns?
No, I just want to, can I
Yes.
just say one thing? I just really, you had some good education out there this past month, little videos and stuff, getting back, and on Facebook and Instagram. It was nice stuff.
Yep.
So, thank you.
Yeah, we had there were some state ones that came out, and there were some
state ones, but local ones too, with the
Yeah.
Fairfield Police, and, you know, making sure everyone's behaving with school, because I know there's a lot of issues with the buses and drop-offs, and they're, you know, everything got moved around, so it was
Yep.
nice, you know, very homey, you know,
I
remind
wouldn't
us.
take credit for that, I had
Oh,
nothing
well,
to
it
do
was
with
very
it.
good.
Yeah.
And I'm always with all the comments, like on Moms of Fairfield, I'm always like, check your Board of Health, check, you know, about the beaches and all that, because you always have it listed, you know, on your site. So I'm like, check the Board of Health. I think you said it too sometimes too. I see yours. You know, how do we know if the beaches are closed? It's always there. So, you know, got good education up there too.
Yeah, I mean, speaking of the other things that we do, like, you know,
Yes.
we still do all the other things.
Yes, I know you still do.
Oh, yeah.
We're still doing environmental health.
They're
we're
all
still doing
done.
teachers, We're still doing
Yeah.
nursing, we're still doing
September 11th.
health
you know,
education,
that was-
we're still
yeah.
doing all the other things, so that's all still happening in addition to the other work.
Can I ask one more question about the schools? Any more thought about just surveillance testing in the schools? I know that.
So we've submitted to the state a request, and we have not heard back from the state. So there was
Nobody has.
the state.
Okay.
The state sent out
Right.
a request. We filled that form out and submitted it to the state, and they said, well, we think we'll get going it was basically the 13th.
I'm sorry.
I'm sorry, go ahead.
They said they expect things to roll out the 13th, but we have not received anything, and I'm not aware of any other health departments that have, and again, I'm just not aware, they may have, but where they're initiating their sort of weekly testing programs. It's you know, optional, those who choose to do it. You know, it's all free, paid for by the state, you know, you get
Weekly testing of who?
unvaccinated individuals, you know, essentially.
But that's, you said that's.
K through.
But you just
Mostly
said,
K
but
through
that
six.
is optional.
Yeah, it's all optional.
Of course.
Yeah, so people would
Well,
opt into that.
I could imagine that it would, like, one of my friends who works in non-medical healthcare, he got certified as a lab, and so he's had all the rapid tests available in his office for CNAs, you know, people who work for him. I could see that having those accessible in the nurse's office, like if a kid feels a little off or something like that, that testing occurs potentially there with permission, and that way you know, okay, do they get sent right home or do they go back to the classroom, you know,
If they're not feeling well, they're gonna get sent home.
like,
No
yeah.
matter what,
Yeah.
Well, I mean, I'm just
We have,
saying if
there's testing broadly available in the town of Fairfield.
Okay.
I literally cannot ask my nurses
They do want it. Yeah,
to
okay,
do
got it.
additional weekly
Yeah.
testing on top of that.
Yeah, no.
This is a private company coming into the schools,
Oh,
you know,
I
one
see
day a
what you're
week,
saying.
Yeah.
Okay.
and basically those who signed up for the program, they can do a screening test once a week, and you know, just the idea is, again, another layer to
Got it,
reduce the
okay.
risk of, you know, pulling out kids as early as possible when they test positive.
Right, and these are only K through 6,
Yeah.
right?
Yeah.
K through 6 and
Really,
unvaccinated.
well
Yeah.
organized, well done.
Sex unvaccinated.
Very
And-
good book.
So we're waiting here to hear from the
Okay.
state.
And do you know with the universities, how often they're testing? Are they testing their students?
So they tested, you know, well, depending on the university, but you know, everybody was tested onboarding, coming to school, and then they are testing unvaccinated. I think they were starting at twice a week initially, and then I think they're sort of considering it as they go forward, depending on the cases that they're getting. But again, I think they're looking at doing every week.
91% vaccination
Yeah.
rate, you know, that's
So-
definitely doable,
Yeah.
you know.
Yeah.
Yeah, Denmark and Sweden, at those rates already removed every single one of their restrictions, masks and everything.
Where we do?
I'm sorry?
Denmark and
Well,
Sweden,
their vaccination
when they
rate,
hit,
so,
what, 80-something
I mean, I
percent, they removed all the, everything's removed now completely.
Something to look forward
Yeah,
to.
I look forward to that.
Right.
Great, so can I get a motion to adjourn if there aren't any other questions?
Motion.
Thank you. All those in favor? Thank you. Meeting adjourned at 9:06. Thank you, everyone.
Thank you.
Let's do this next month.